Hi guys, Stacy here from Marble Hill Orthodontics. Today we are going to review how to turn the expander with the key, okay? So when you get the expander, you're gonna notice that there's little arrows, and that's gonna tell you which way to turn the expander. The key has a little straight beveled edge, and that you're gonna drop into the little hole. The first hole is gonna appear right up here at the top. You're gonna place the expander key in the hole, feel it go in, and then with a pivot motion, you're just going to push down straight until you feel it click, okay? The expander does not turn with the handle like that. So you just do a little pivot motion, okay? Then with a very light grip, you're just gonna let that key fall out. If you resist the key coming out, it will cause a friction, and you sometimes can undo the turn, and that will only make sure that you did a half a turn. So you wanna make sure that that turn is done completely until you see the next hole appear, okay? Turn it as instructed by the doctor. As far as the care of the expander, what we're gonna ask you to do is throughout the day, you're gonna rinse your mouth with water every time you eat something. And at nighttime, you're gonna do the big cleaning. So you're gonna brush your teeth normal, and then I want you to brush up around that expander. And you wanna make sure that you get back here by these, it's called a tube for the arch wire. You wanna make sure that you get back there because these are right up against the gum line, and plaque and food and debris love to hide in there. So you wanna make sure you get back there with that toothbrush, okay? So brush really well, you're gonna loosen. You gotta make sure you clean all that debris out so your parents can see that hole. Then what you're gonna do is you're gonna fill a cup up with water, and you're gonna stick your little monoject in there, and you're gonna slowly pull up on the plunger. And then you're gonna lean over the sink, and what you're gonna do is you're gonna flush the water all through that expander, and you're rinsing out all the stuff you've loosened with that toothbrush. And you wanna do that at least twice, okay? Now sometimes these bands can cause irritation on the inside of the cheek. If that happens, warm salt water rinse will help heal the cheek tissue, and then what you're gonna do is you're gonna place a small piece of wax back there. So you're gonna roll it up into a little ball. It's best if you pull the cheek out and kind of suck in some air, and then you're going to just push that wax on that band. Now your cheek has something soft to rest against, and the warm salt water rinse will help heal that tissue, okay? Now, after brushing and rinsing with the monoject, if your child still feels like they've got something stuck up there, sometimes lettuce or spinach can lay flat on the roof of the mouth and the brush just can't get to it. If that happens, you can use this guy. It's called a proxy brush, okay? And what that will do, that will get way up underneath where if sometimes the brush can't get there and the monoject. So this is a really good tool to have just in case, okay? And then if you do have a really bad irritation, you can use this peroxyl rinse. Best time to use it is at nighttime, and you can always buy that at your pharmacy, Walgreens, or Walmart. And that's the review on how to turn the expander and how to care for your expander. And just a note, the no-no list, we basically want the kids to stay away from popcorn. That's the major one. Popcorn shells love to slide up along those bands, and they will not break down in the body. That will cause a gum irritation, and so if they must have something that mimics popcorn, you can use Pirate's Booty or Goldfish or little pretzel sticks. Also, you want to be careful when your child is biting something with force, maybe like a carrot stick, not to bite directly on that band. If they bite something really hard on that band, it'll break the seal of the cement and the expander can come loose. So I'll ask them to chew more back here if they're chewing foods that require like a lot of force, such as carrots or I don't know, maybe like a pretzel rod. And that's basically about it. You can always visit our website for more information and give us a call. We're always here for you at Marble Hill Orthodontics.